topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the finest experts in the field of legal, health, financial, and home improvement. What a show we have for you this afternoon, only because I suffer from sleep apnea. This is not just in the city of Houston, but the state of Texas. We have the top ENT doctor, and when it comes to sleep apnea, sleep disorders, snoring, Dr. James Ludwig is the best. Hey, good afternoon, James.
What's up, Steve?
Hey, listen, I love doing this show because it really hits home for me, but God, I just saw where we've got so many new listeners, and I want to find out, tell people about your Sugarland ENT and Sleep Center.
Well, I'm located in Sugarland, Texas at University in 59, and I'm a solo practitioner since 2006. Let me close this door for you guys. Anyway, sorry about that. Patient leaving. I do see patients, real life. But I see a lot of sleep patients, a lot of sinus, nose. A good ENT that knows a lot about sleep apnea is a great resource for a patient because, sleep apnea is an upper airway problem, and there's no better, professional to address obstructive sleep apnea than a well-trained and double-boarded, like I am, sleep physician, ear, nose, and throat surgeon, because there's a lot of things that we can do to help patients treat sleep apnea, both by improving, nasal breathing and obstruction and sinus issues, which for whatever reason, a lot of sleep apnea patients seem to suffer from, and then help them with, the other treatments for breathing, for the obstructions like CPAP or appliances. I do those. And then there's some new technologies that are coming out that I think are great. I wanted to talk about one of them with y'all today that literally just got FDA approval, I believe in August of this year. It's been in Europe for about 5 or 6 years. But I think it's going to be an option for some patients who are unable to use, I know you're good at using CPAP, but not everybody is. Something that's not too drastic or, out there, but something that does a good job of treating obstructions and that you can live with. So I'm pretty excited about this new technology. I'm sure you've heard of Inspire. It's been out now Inspire's been out for about 10 years, and it's been in the United States. They've had a heavy push this last 18 months to 24 months, a lot of salespeople out there and commercials on TV. So a lot of people have heard of Inspire. Have you heard of Inspire, Steve?
Oh, absolutely. I see their ads all the time.
Do you know what that is?
It's a surgical procedure, right?
Yeah, so it falls in the category called hypoglossal nerve stimulation, and until recently, at least in the U.S., they were really the only procedure available to treat sleep apnea through neuromodulation, which is, it's a neat concept. Instead of going in there and altering your anatomy, cutting on your palate or your tongue or doing things like that usually permanently alter your throat anatomy. This philosophy of treatment, the strategy is to actually stimulate the tongue nerve, the motor nerve to the tongue, to move the tongue and related structures out of the way as you're breathing. And then when during the day, it's not activated. So it doesn't affect how you swallow. It doesn't change, like I said, your throat. Most of these surgeries that you do on the throat, they can do a pretty good job of improving sleep apnea severity, but usually you trade off some other things, like feeling like there's a lump in your throat, or because you are changing the anatomy of the throat, maybe some swallowing issues. When you do neuromodulation, you're not changing the anatomy of the throat permanently. You're only stimulating the muscles of the throat, the tongue specifically, while you're sleeping. And this new device called Genio system. The Genio is the name of it, and right now they're on their second generation. It's like I'll show you what it looks like. At least I'll show you a model of what it is. This is a template we use in the operating room. That's how big it is, right there.
Wow.
And okay. So what's cool about this is these two, the tabs on the sides are electrodes, and these electrodes lay over the tongue nerve, the motor nerve that pushes the tongue forward when you're sleeping. And this is implanted with one incision under your chin. So Inspire, until very recently, required 3 incisions. Now I guess they're down to 2 incisions, but it's a chest incision and a neck incision. And you install a battery generator in your chest, kind of like a pacemaker for your heart, except your heart's on the left, not the right. So you put the Inspire on the right, and then that is the brain and the energy, because it's a battery. And then the wire goes up to your neck, and then the incision is made in your neck so that we can put the lead or the electrode around the nerve to your tongue. Okay. And then when you sleep, it senses your inspiration and it shocks your tongue. So the problem, there are good things about that. There are bad things about that. There's multiple incisions on multiple parts of your body. You're only you're innervating one side of the tongue, not both sides. But an obvious one is the battery's going to die someday, and you're going to have to replace the battery.
Yes.
Anyone that gets a boob job knows that you don't get one boob job, because you have to get them replaced, every 8 to 10 years. And that's something that you buy when you buy a breast augmentation, and people that get that done they're well aware of it, and they are okay with that. But the great thing about Genio is the power source is actually external. This is the power source. And so this is also the brains. So if there are any, updates to the algorithms or the way that they're going to activate this electrode, it's all done externally. It can be, there's unlimited updates you can get. You charge this at night, so you never have to have a battery placed in your body, because there is no battery in your body. This weighs about 1 ounce. I don't know the exact amount. It's very light, maybe even less than 30 grams. And then you tape it to so this is the one thing that is a little different. You tape it. Let's see if I got one here. I'll show you. You tape it to your chin. And this holds the power source like this. So this is what goes on your chin. And then the next day you take it off, and you put another one on the next night. So, but this is, like I said, it has a similar efficacy to Inspire. It's a less invasive procedure than Inspire. If you don't like an Inspire, you have to go and if you want the whole thing removed, you have to go and cut those same 2 or 3 places and remove all the hardware and wiring, the wire around your nerve. If you're unhappy with this, you just go through the same incision that you can't see in your neck, and you take it out. So I think for me, it's, I like oral appliance therapy. I like CPAP. I like anything. I like whatever you'll use. I really do. I don't really care what you do. I sound like I'm being a jerk when I talk to my patients. I don't care what you do, as long as you do something that you like and can live with. That's what's important about treating sleep apnea. And this is just another, this is another tool in the toolbox that you can look at. And I think, from a patient side, it's really not that invasive, an incision under the chin. Actually, when you do the surgery, I just went through the training. It's really not a lot of cutting. You're really more, you're actually going through natural tissue planes to find a pocket that you'll lay this in. It's not like the only thing you're really cutting is the skin and the first layer of muscles. After that, it's really just a midline blunt dissection down to the area you need to get to, and a lot of retracting and placement of this electrode. it's not actually a very invasive procedure. Now, this is not good probably for a guy like you, Steve, I'm sorry to say, because the way that this external power source
You just use it at night, right, James?
yeah, this will be in your body, but this is only on you, of course. Yeah.
Right.
But this is like kind of like how you charge your phone with your magnet instead of plugging the phone in through induction. So this is powering this through induction. And if you have a 25, 2-inch neck, you're going to be like this far away, and so you won't be able to. So for those patients with very high BMIs, body mass index, really big necks, this is not going to be a solution for them. But honestly, I have so many patients that have more, like they're 20, 30, 40 pounds overweight. Their BMIs are like 32, who can't use air pressure therapy. Who, what the problem is I see so many people who can't use air pressure, and so they just don't do anything. They just like, oh, I can't use CPAP, so they don't even know this exists. No one even tells them this stuff exists. So I encourage people to learn about the different things that are available. And that's why I love my practice, because for 20 years I have dispensed CPAP equipment. For 10 years, I had my own 2-bed laboratory. We did real sleep studies, 50, 60 electrodes on you. For 20 years, I've dispensed oral appliances. And for 20 years, I've done sleep surgery. So that gives you insight on how to use all these different modalities, and not just one modality. Sometimes you want to use multiple modalities, and it lets me, think about treating somebody in multiple ways instead of just a one-trick pony solution. That other health providers that treat sleep, I know you have another dentist or something who does a show. He's a dentist and he does oral appliances, and I know he knows about CPAP. I know he's never done a sleep surgery. I know he's never done a nasal surgery. I know he doesn't know. I know he knows they exist, but
Right.
knowing they exist is not the same thing as doing them. They're just not the same. There's a cardiologist is not a cardiothoracic surgeon. Okay. You don't want a cardiologist cracking your chest open and, trying to do your bypass surgery. Trust me. But I would trust that cardiothoracic surgeon to prescribe me a blood pressure medicine. Do you know what I mean? I'm not trying to dig on anyone. I'm just saying that surgeons, like head and neck surgeons that we do a lot of medical management, but medical physicians can't operate. They're not surgeons.
I got to tell you, my texts are going crazy with questions. Let me get first one. Hilda wants to know, does it leave a bad scar?
No, you're going to have a 5 to 6 centimeter scar here, so it's pretty discreet. Now, if you do Inspire, the problem is it goes on your chest. You have a big scar across your pec. And then often I've seen a lot of hypertrophic scars because it is an implant. So it stretches the skin and creates like a wide scar. And also it creates a lump. So you see the mass of the implant, even on guys I've seen guys that have pretty thick chests, and you can just see this, fullness. So for men, again, if you need it, you need it. But if it was me, if it's between Inspire and this is, and you're a good candidate for Genio, I think it's less of a leap to try Genio. I think it's less. It's less scars, it's less incisions, it's less invasive. It's just a much more reasonable option, because let's be clear, and no option is perfect. And no option gives you 100% clearance of your obstructions most of the time. They may do it some of the time, but it's not most of the time. So when people are going for products like Genio or Inspire or sleep surgery, better is a win. A lot better is a win. Being quote unquote sleep apnea free, where you don't have any airway breathing issues whatsoever, is not something I tell my patients to expect, but I tell them to expect a lot better. That's the goal, to get you a lot better. And that's why people who are on air pressure that use it all the time, like you do, Steve, who have excellent therapy, it's hard to give up excellent therapy for something that makes you a lot better or better when have excellent,
I know you do a lot of research. So tell me what the downside of this is.
The downside is you get it and it doesn't work. You can't tolerate the electrical shock. You can't tolerate, but that's what I mean is, so what is the downside is that the worst case scenario is you don't like it and or it doesn't work enough, because again, we're picking candidates based on who it should work for, but again, it's not a guarantee. But the worst case is that after you're implanted and you wait your 2 months to heal and it's programmed for you, you're either the therapy isn't effective enough or you're intolerant. And so what you would do is just go through the same, even smaller incision, because if you're taking it out, it's easier, and then remove it. That's the worst case scenario, and that's the worst case scenario for Inspire. The problem is I've taken out Inspires and it's a lot more going on. It's going from your chest to your neck, and there's an electrode that goes from your chest to your neck. Not that you can't take that out, but now I got to cut your neck again. And it's not here, it's in the lateral neck, So, and that electrode is wrapped around your motor nerve. And I don't know, do we need to unwrap it from around your motor nerve to risk the nerve function, or just leave it alone, leave it in there like a bullet, I think the downside is very low. I think the upside is very high. So that's my kind of rationale for favoring that therapy.
So everybody wants to know about what is the cost versus Inspire.
They're the same.
Oh, okay.
The same code pretty much, and the same surgeon fee, and the same, I think the hospital gets the same fee. So if you're getting Inspire or you're getting Genio, you're going to meet your out-of-pocket maximum. I'll tell you that. If it's $2,000 or $3,000 or whatever, if you've already met it, then it's going to be zero to you. It's covered, I will say, for most. It's not all. It's so new, it is FDA approved, but it's very new. So for most insurances that I'm aware of, it's covered. But you would go through a pre-authorization process before you would go and have this put in. So it's not like you're not going to know before you do it. The same holds true for Inspire. You have to go through a pre-authorization process. But that is done for every patient.
Do you have to miss any work?
A little. Again, I love head and neck surgery because you can do a lot to someone's head and neck and they can still walk. Your head sits on your body, It's not like abdominal surgery or back surgery or, a leg or hip or knee. You can ambulate. When I trained at, one of the institutions that I rotate through is MD Anderson, and you can do a neck dissection and take off part of someone's tongue and they're walking around the hallways the next day. It's not like abdominal surgery. People tolerate head and neck surgery. You do get swelling under your chin. We do a lot of retraction in this area, so it does swell and it's going to be uncomfortable, but it's not, I'll tell you one thing, it's a lot less uncomfortable than throat surgery. Tonsils, tonsillectomy, palate procedures, hyoid suspension, tongue-based reductions, other ways that we try to alter the throat anatomy to improve sleep apnea. It's definitely going to be way less uncomfortable than that to recover from.
Here's a great question. This is Heidi in Memorial. Because of your show, I finally have talked my husband in to make an appointment with you. I love what you're talking about. Now, will Medicare pay for this?
Yes, they will, as far as I'm aware.
Medicare will cover it?
They will. Yeah.
Oh, that's great.
The nice thing is that hypoglossal nerve stimulation is not new. Okay. That, again, it's been around for a decade, FDA approved. So what's new about this product, it's a different philosophy on how to deliver that stimulation to the tongue. Inspire, their philosophy is to measure inspiration and then deliver a unilateral pulse to the tongue, and they do it during inspiration. But part of that's because they have a limited power supply and they don't want to burn through their battery very quickly. So they don't want to send any energy to the tongue or they want to at least limit the energy they're giving, because again, they have a defined amount of energy. But Genio doesn't have that problem. They have unlimited energy. Every night you put it on a charging station, just like your phone. You get a whole other day to talk on your phone. You're not worried about it with your phone. You don't worry about it with this. So their philosophy is to do bilateral stimulation, and they do it more on a timer as opposed to breath rate. And that's why they don't require another incision and wiring to measure inspiration. Because, if you've ever watched somebody, and I have the luxury of watching lots of people actually have sleep apnea real time, because we do a procedure called drug-induced sleep endoscopy. And that's when we look at people's airways when we knock them out with drugs, so we can understand why they have sleep apnea, like anatomically why they have obstruction. And it's not like the tongue is moving in and out. It's like it doesn't fall back when you take a breath in and then push out when you breathe out and in. That's not how it works. When it falls back, it stays there for a while until you have an arousal to kick it back forward. So they're more like providing the tongue tone, like almost like a constant, well, it's intermittent, but like basically regular tonal inputs to keep the tongue forward, where Inspire is really trying to conserve energy and only pulse the tongue during periods of inspiration, so that to make sure the tongue's out of the way as much as possible during those periods that you're trying to take a breath. So it's just a different philosophical mechanism of the same therapy, which is stimulating the tongue so the tongue moves forward and therefore eliminates obstruction.
Bottom line is no CPAP machine, huh?
Right. Well, again, I mean, if you can't use CPAP or you hate your machine, it's the devil.
If you qualify for this.
What's that? Yeah, to qualify, you have to have your AHI 15 to, shoot me, I don't know, 15 to 50 or 15 to 65, and then your BMI 32. There's some other technical things, but I mean, that's the main two driver. I think age over 18 or 22 years old and you qualify. So it's for adults, not for children. I think it's a good option for some people. I would consider this to be minimally invasive, honestly. I mean, we do way worse to people to treat their sleep apnea. So I would call this minimally invasive, in my opinion, and easily reversible.
James, I got to get this last text in because it shows how people pay attention. I've been listening to your show for the last 3 months. I'm dying to find out how your lawsuit is going with the insurance companies.
My lawsuit.
People listen.
Yeah, I guess they know my voice. I don't have any right now, but yeah, things are going fine. Yeah, they move. It's actually not insurance. I'll leave it at that.
Okay. Hey, James will be back again with us next month. Give everybody your phone number, and you have a website too you can give out.
Yeah, sugarlandent.com and 281-556-1102.
Man, this sounds so exciting. Again, I'm on a CPAP machine, and gosh, if there's something out there better, it's something to look into. But the main thing I'm hoping with this show is do something.
Yeah.
Call James's office, do something. Don't let it go like I did. And
James, a
James,
lot of people do
so
that,
much.
Steve. Don't feel too guilty, man.
I know. Hey, have a good Thanksgiving, bro.
Thank you. Take care.
I'll see you soon.
Bye-bye.
That's Dr. James Ludwig. He is an incredible. I swear, I've learned more from doing his show than I have probably in the last 10 years of being a sufferer from sleep apnea. We're going to go to a short break. We'll be right back with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.